As part of a drive to develop the strategy for a thriving NHS for North Cumbria and the North East, 4 events were held in January and February across the region. With 450 people invited, NHS staff, patients, voluntary workers, partners and local authority representatives came together to help create the recommendations for a healthcare strategy over the next 4 to 5 years. These were people who really knew what was happening on the ground within their communities. Before everyone got to work, system leaders shared information on the digital future, the health challenges faced by the region's population, as well as the ambition and progress on system developments locally and across North Cumbria and the North East. At each event, the participants looked at 10 different health perspectives and provided their recommendations on the what their priorities are, and the how, what the challenges are to achieve their priorities and how they would overcome them, with a focus on creating a better place where everyone lives, works and cares. Each of the events generated enthusiasm, passion, frustration, energy and debate. With a wealth of detail on recommendations from the participants, here are some of the things that people want to see. In diagnostic services, there is a desire to create more effective pathways, with point-of-care testing in primary care or communities, and providing greater ownership for patients with access to their health records. Getting the basics right is essential, with IT infrastructure, IT system convergence, and using the same systems and standards. The first 1,000 days are key, ensuring healthy communities that support health and well-being and a healthy work-life balance developing into a healthy retirement. Strive for greater community integration to ensure retention of staff and create a ladder of success for all. Ensure CPD is done in a transparent way, opening up routes to other roles in the NHS. There needs to be greater integration across sectors, broadening involvement from the education and housing sectors, local business, hosting improvement events together, ultimately reducing poverty and unequal access. There is a need for accurate and timely assistance of need, as close to the person's home as possible, with the stability of the workforce key. From a social perspective, it's essential to change how older people are portrayed, creating dementia-friendly communities. The landscape is now, so get on with the job and keep momentum to help local communities thrive. Socio-economic and health inequalities need to be tackled, ensuring early intervention in early years. Build systems around people and create equitable access to services, optimising quality and value. Bring services together in key locations. Focus on individuals' needs at a location they feel comfortable. Create one data system around the person. Demedicalise health records and hand to the person to own them. Connect primary care into the bigger system, with more clarity on PCN contracts. Push for funding, primary care hubs and digital support. Of course, there are lots of things already happening across the patch, and many of these recommendations provide reassurance we are doing the right thing. The recommendations received will also feed into the many clinical initiatives in place or already being planned. However, there were a number of things highlighted that maybe we need to give a little more recognition and airtime to. The recommendations will help to pinpoint what and where. Things are happening in pockets, but we need to work on finding a more systematic way of doing these things and addressing the issues together, right across the North East and North Cumbria. We need a way of listening to the patients and public more effectively. Systematic collaboration with local authorities and voluntary sector. Effective communication across the system. Effective mechanisms for the rapid diffusion of innovation and improving practice across the system. Clarity on where decision-making sits, whether this is PLACE, ICP or ICS, and capitalising on the richness of public health data to shape that decision-making. How to mitigate risk, where decisions are made for the benefit of the system but may impact adversely on individual organisations. How does the NHS, as the single biggest employer, influence health and well-being for staff and create a collective voice to supporting individual local authorities? Understand the important role primary care networks can play as the fundamental building block of the system. Allied health professionals, optometrists and pharmacists play a critical role in delivering healthcare differently. How do we bring their voices to the table in a more effective way? Ensure information technology is used to accelerate improvement, create new roles working more flexibly, and enabling factors like staff passports to allow people to work across different organisations. Finally, our participants had a number of challenges for all of our system leaders. Innovation must be supported and encouraged. Trust and give permission to staff to make the changes that need to be made, and really listen to staff. Organisations must pledge to commit to system working and join up services around the patients and not the trusts. The focus must be more on outcomes and less on cost, identifying the benefits across the whole pathway. Governance, budgets and guidelines must be shared. Invest in the workforce, giving time out for development, flexible work patterns or contracts, and allowing for multifunctional roles where competencies are emphasised, not professions. Allow failure, but always be brave, bold and courageous. The process of everyone collectively coming together to achieve positive outcomes has shown that if we work together, we can achieve more efficient, more effective healthcare services and a healthier NHS for everyone across North Cumbria and the North East. There are strong messages that many national initiatives will be devolved to system level, giving us even more opportunity to control and shape how we develop our staff and how we deliver healthcare. Now is the time for the system leadership to be bold and to be brave. Everyone has a role to play.